You want me to do attendance?
Yeah, do attendance and then we'll talk about Manzanito.
Okay. Megan, people are popping in. Could you keep an eye on that waiting room and let people in as they come in? Sorry, you heard my voice twice. Okay. When I call your name, please say yes, no. Please let me know that you're here. So please come off the mute. Aaliyah Armstrong. Faith Dayton. Teresa DeSimone.
Here.
Jacqueline Williams.
Here.
Joanna Olson.
Here.
Paul Davis.
Here.
Anyone from Mendocino Community Health Clinics?
Present. This is Noemi Guerrero.
Excellent. Welcome, Naomi.
Thank you.
Karen Lovato or Naveen Badahari from Mendocino County Department of Social. There you are, Karen.
Lovato here. Thank you.
Blythe Post.
I am here and it looks like there's two of me. I don't know how that's possible, but
I'll work on that. Amanda Archer. Judy Albert.
Here.
Sage Wolf.
I'm here until about 2:25, 2:30, and then I have Sam Neto is our B2 supervisor, and they're going to step in for the second half of the meeting for me, if that's okay.
Perfect. Thank you.
That's fine.
Dan McIntyre.
Here.
Sandra Stolfi.
Here.
And I also have recorded Denise Gordy. And are there any other COC members present I may have missed?
Angelica's here.
Oh, Angelica? Okay, excellent.
Hi there.
Hi, down on the bottom, I missed you. Oh, because you're the next step. Okay, got it. Okay, we have 11 COC board members present and have a quorum.
Thank you, Veronica. You want to go over Manzanita's?
Yes. Immediately following the agenda, so page 4 of the packet for today, you'll see a letter from Wynn Novotny resigning Manzanita Services seat from the board and rescinding their nomination or their membership as a COC member due to dissolution of the organization. And so that leaves one more board seat open. That means that we have a total of 14 voting members at this time that are appointed. So our quorum is 8 at this time. That's all I have.
Thank you, Veronica. Is there any public comment on any non-agendized items? Did you have any public comments sent in via email, Veronica?
None received.
Okay. Not seeing any hands up and not hearing any public comment, we're going to move on to approval of the minutes for November 21st, 2022. Too many years in there.
I
So
move
the
to
first-
approve.
Okay.
Okay, there's a second.
I'll second.
Thank you, Teresa. Is there any discussion or corrections to those minutes? Roll call, Veronica.
Please say yes, no, or abstain when I call your name. Teresa DeSimone.
Yes.
Jacqueline Williams.
Yes.
Joanna Olson.
Yes.
Paul Davis.
Abstain.
Naomi Guerrera.
Yes.
Karen Lovato.
Yes.
Live Post.
abstain.
Judy Albert.
Yes.
Sage Wolf.
Yes.
Dan McIntyre,
Yes.
Sandra Stolfi, Sandra, I'm going to put abstain as we're not hearing back from her. Motion passed.
Yeah.
I'm here, sorry. I thought on issue too.
Now we get approval of the November 28th special COC board meeting minutes.
I'll move approval.
I'll second.
Thank you. Is there any discussion or corrections to those minutes? Not hearing any. Roll call, please, Veronica.
Teresa DeSimone,
Here.
yes, no, or abstain?
Yes.
I'm sorry, Teresa, was that yes, no, or abstain to the November 28th board meeting minutes?
It was a yes.
Okay, sorry, I heard
Sorry.
you. It's okay. Jacqueline Williams,
Yes.
Joanna Olson,
Abstain.
Paul Davis,
Abstain.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post.
Abstain.
Amanda Archer has joined us recently. Amanda, we're voting right now on the November 28th, 2022 COC board minutes. Yes, no, or abstain? Oops, I think Amanda froze. So I'm going to put abstain. Judy Albert,
Yes.
Sage Wolf,
Yes.
Dan McIntyre,
Abstain.
Sandra Stolfi.
Abstain.
Motion passed.
Thank you. Do we need to approve the 27th of February meetings, even though there is no meeting?
Same thing happened on November the
28th?
21st, the first one, I thought, and that's why we had
The
to have a
28th.
special meeting. Okay,
Whatever. We'll approve them.
okay, yeah.
Any motion to approve the 27th of February meeting?
I'll move to do
A
so.
second. Thanks, Sage.
I second it.
Thank you, Judy. Any questions or discussions? Changes? Roll call, Veronica?
Teresa DeSimone,
Abstain.
Jacqueline Williams,
Yes.
Joanna Olson,
Abstain.
Paul Davis,
Abstain.
Noemi Guerrero,
Abstain.
Karen Lovato,
Yes.
Blythe Post.
Abstain.
Amanda Archer has not joined us yet.
I'm here.
Oh, you're that's
Hi, sorry, I was having internet difficulties. Yes.
excellent. Thank you. Judy Albert,
Yes.
Sage Wolf,
Yes.
Dan McIntyre,
Yes.
Sandra Stolfi.
Yes.
Motion passed.
Thank you. I'm going to go on to reports and presentations and updates from the local jurisdictions. We'll start with County of Mendocino, Karen Lovato or Megan.
I think the primary thing that I had to announce had to do with Manzanita's closure. Behavioral Health and Recovery Services is operating wellness centers out of the Veterans Hall in Willits and the 1120 South Doris Street office at Behavioral Health Tuesday through Thursday, 10 a.m. to 2:30 p.m. As an interim between Manzanita's closure and the planning for next 3-year plan for MHSA programs.
Any questions for Karen?
Karen, is that posted somewhere so we can relay that? And I know that you don't know anything about the future, but I always felt that Manzanita was a key component in terms of assisting people with mental health. And I always hate to see a program like that disappear from our county. It seems like it, you know, it really was a referral source oftentimes for our agency. So, I mean, I know that you can't predict the future, but is there some intentionality in trying to keep a program like that going?
Yeah, so peer-based wellness centers are absolutely a value of the Mental Health Services Act that funds them. And we had been in an RFP process for the next 3-year plan because MHSA does all of our planning in 3-year cycles. And so the 2023 to 2026 3-year planning cycle has already begun, and RFPs had been opened and are in reviews at this point. And so certainly peer-based wellness centers continue to be a value, but I can't speak to any kind of specifics beyond, yes, we value them, and we will make sure that we're working on plans for wellness centers to be a part of our continuum.
Okay. Are those times and dates, are those posted on your?
Oh, they are on the website. Yes, they are on the website. The previous Manzanita sites had them posted as well. We made sure that there was an overlapping week that the behavioral health wellness centers opened before the Manzanita centers closed, so that clients coming to the center during that overlapping week could check out the wellness centers with a bit of a safety net if they'd like. And then we also have our mobile outreach folks checking by those former Manzanita locations at the beginning of the wellness center day at 10 o'clock to see if anybody needs assistance in getting over to the wellness centers.
Thank you.
Just really quick, Karen, which website are you specifically referencing? Because I'm on the Behavioral Health and Recovery Services main site, and I don't see anything.
Okay, it should be on the MHSA site, but if it's not, I'll make sure it's there by the end of today.
Okay, this isn't the MHSA site. This is just the home.
Okay.
So if you could find that and just send it to me via email, and I can send it out to the group, that would be great.
It's not a problem. We have a flyer. I can get that to you right now.
Thank you.
Any other questions for Karen? Megan, do you have anything?
Super quick. And then just to let the board know, I have to hop off for another meeting and then I'm going to hop back on. So I'm going to suddenly vanish right after I say what I'm going to say. So county updates from my end. I just wanted to let the group know, most of you are aware, but maybe not all of you. We did formally launch our Front Door for Families program. This is the initiative focused on households with children experiencing homelessness. If you remember, the county received a Family Homelessness Challenge grant. And we are also incorporating Bringing Families Home with it, which is a funding source specifically for families experiencing homelessness who are also involved in the child welfare system. So we're super excited. The website is live, frontdoormendocino.org. It's sort of the fulfillment of a dream of mine. So I'm really excited to have that launched into the community, and I can answer any specific questions, and I'll just make sure that we include the website address in the minutes as well. Simultaneously with that, we have relaunched our Housing Flex Fund. This was a pretty flexible funding source that we had available during the pandemic. It's a little bit more, it's tightened up now. There's some more parameters to it. It's not quite so loose, but we do have a more organized process for households that are experiencing homelessness to seek financial resources if there are no other options for them. This is for things like security deposits, some rental assistance, possibly application fees, utility deposits if they need to be able to turn on electricity. It's dependent on the past due bills, things like that. I'll also ask Veronica to include a link to the website information about that fund as well.
Thank you, Megan. Is there any questions for Megan?
just a big appreciation. Those informational sessions that you had on both of those things, and you did it on Live Oak as well. Like you guys have had a practice of doing those, and they are so helpful. And like I think all of the projects in Mendocino County, we could benefit from like everybody doing like even just an annual come to this open Zoom and let me tell you about our program thing. But so I just really appreciate, I know that there's like that there's effort and energy that goes into putting those together, and you guys have done a really amazing job.
Thank you, Sage. I did, we did 2 informational Zooms in kind of short order, and I did appreciate it. And I agree with you. I would love to attend some informational Zooms on some other people's projects. That is one, I'm not a big, huge fan of Zoom type information, but this is a really good use of it when you just want to tell somebody about a new project without everyone having to go to a meeting. So.
Yeah, and I just second that, Megan. It was super helpful for us that are serving families in the community, and really great.
Great, thank you.
Thanks, Megan. We'll move on to City Ricaya. I don't see Shannon here. Well, we'll skip Shannon. And we're going to skip, there's no Fort Bragg or Point Arena. Okay, well, is there any other updates from local jurisdictions that I missed? I don't see any. We'll move on to standing committee reports, strategic planning. I don't have anything. And Megan just ran away. So we have not met, and I don't think we have a meeting scheduled anytime soon. So we're going to move on to shelters and solutions. And Helica?
We haven't had a meeting in a while, been MIA. So you have to think about maybe regrouping. There's anything in particular also that the board wants us to work on that would be helpful. So that, the work that we do is more meaningful and actually develops into something. If we have a meeting in April, it would be the 2nd. So it'd be April 11th at 11 by Zoom.
And Helica, one item that has come up, it was discussed by the Strategic Planning Committee, is we don't have any written standards on our non-congregate shelter projects. Like our COC written standards address congregate shelter, but it doesn't address non-congregate shelter, which is like motel vouchers and similar interventions like that. And so something that committee could look at is how would the COC like to have those, how would we like to prioritize those services? Because if we go first come, first serve, like we're going to run out in 5 minutes. Like there's way more demand than there is resources available. And so we need to be able to have a way to discern how we utilize and issue those resources. And I think that the Shelter and Solutions Committee could be a really great place to have that discussion.
Okay, so it probably involved kind of collecting also if other communities have been doing it and how they've been doing it, and kind of seeing what has worked and maybe what has not. Okay, all right, thanks, Veronica.
Yeah, you're welcome.
So Veronica, this is Judy. Before when we were talking just about resources and and Megan doing her Zoom call and everything. Sometimes I am not aware of other agencies that have motel vouchers available to them and, what their criteria are. I mean, we use, the motel vouchers that we have through the HMIS, sometimes for specific clients that we figure will not blend well into a congregate setting, or because they have animals and we don't have a place to accommodate the animals. But I mean, that will probably end at the end of September and we won't have those. But I know that there's other resources out there, but I don't know what the criteria is, and I don't know who necessarily has them.
And that's exactly what I was talking about, that the COC should have a standard prioritization and a standard approach to how non-congregate shelter funds are used, so that those questions of, well, I don't know who it's for or how it helps or anything like that. That way the community is clear, this is how the COC programs operate. And we probably will have different priorities, different processes for single adults versus families versus people who are in mental health crisis versus people, who may be seniors. And so, there's different population needs. And so that's really the kind of direction and input that we need from the Shelter and Solutions Committee.
Right. And also just in terms of you're going to make a referral because the person doesn't fit into any of the criteria that this agency has, who is the more appropriate agency, not just to do a pass on, but an actual, thoughtful pass on to
Right.
what other agency might help the person.
And because we only have 2 funded projects through the COC funding, and that's Ford Street project has a very small non-congregate shelter contract for families. And McHaven has exhausted their ESG CV funds for their non-congregate shelter, but today we'll be looking at giving them some additional HAP funds to continue that project. And those are the only 2 that I'm aware of beyond like what I know MHSA funds can be used sometimes for that. And there's, full service partnerships and things like that. But as far as just we offer a non-congregate shelter program, those are the only 2 I know of.
Okay, thank you.
Any other questions or comments for Angelica? Oh, okay, Angelica.
I even hesitate to speak up, but we have RCS has a really tiny little amount of funds for non-congregate shelter for families with kids, but it really only covers like maybe 10 families a year for a week apiece. It's pretty small, but so we don't really advertise it very much because it gets used so quickly, right? But I do want to just throw it out there. And one of the things that we have come up against is with such a small amount of money, how do we prioritize for the people coming and seeking help? And we do have some things that we put in place, but it would be great if the COC had some guidance around that we as a community had, because I certainly have struggled through this trying to figure out how to best use that tiny amount of money, right? So.
Thank you, Sage. We'll move on to coordinated discharge planning, Sage.
Let's see. Just want to update on in March, we had our first Housing Mendo case conferencing meeting where we really focused on our permanent supportive housing project through the CDC's permanent supportive housing project. It was a really great meeting and one that, so we're going to be continuing that process of doing some really like deep dive into our PSH and case conferencing about those clients. It was super helpful for our agencies that are providing the supportive services or may not have realized that they're providing supportive services or that their name is attached to clients in PSH. So we're starting to really look at the permanent supportive housing client list and be able to see who actually is getting supportive services, who's not, what are the agencies attached, are they supposed to be attached? And so this is the little anxiety making right now, because it's like it's just a little anxiety making right now as our agencies are going, oh, I didn't know that I was assigned to that client. Okay, let's figure that out. But it's a great process, and I'm just really glad that we're going through it and getting cleaned up on what we're doing. And then the other update, we've been digging into the coordinated entry by name list and have implemented a process for being able to exit people from the coordinated entry by name list if they haven't been engaging in services. And through that, we have a much more the people who are on our by name list are much more likely to be engaged. So when they do get connected to a housing resource like PSH or like Rapid Rehousing, we're a lot more likely to get a hold of them because they are recently engaged, rather than we used to have a list of people who have been screened a year ago, 2 years ago. And so we've been doing a lot of work around cleaning that up so that we're exiting people properly from coordinated entry. And we also had a great conversation with Sandra and folks from Nation's Finest about coordinated entry and veterans in that process. And we're working on a transfer policy of how a person who is in, who meets the criteria for chronic homelessness, if they go into a rapid rehousing project thinking that they only need assistance for a short period of time, but end up really needing that permanent supportive housing element, how a person who becomes housed through rapid rehousing can be transferred over to permanent supportive housing. So we're working on a transfer policy around that. And we have our coordinated entry list manager agency coming online. That is going to be approved later. It's going to be approved later in this meeting because yes, we should approve it later in this meeting. Okay, thank you. That's all.
Thank you, Sage. Any questions for Sage? Okay, not hearing any. We'll move on to membership committee. Veronica?
There's an item on the agenda that we can disregard as Mendocino Community Health Clinics is represented today. I wanted to welcome Naomi Guerrero. I had reached out hoping that maybe she would know someone who could attend and represent the agency. And she said, well, why not me? So welcome, Naomi. We're really glad to have you. The membership committee hasn't met because I'm strapped for time. And we just haven't had the bandwidth to be able to do that. So if someone is really worried about the membership committee work, please let me know and we can have a meeting. But otherwise, until we have more than one HMIS lead staff, I don't think I'm going to be able to take on leading those meetings. But once we have our HMIS staffing back, I'm pretty sure I can take that back on.
Thank you, Veronica. Veronica, do you want to go over HMS and the request from HUD?
Yeah, there was something else that I was supposed to share as well, but I don't remember. It'll come to me. So we received a request from HUD and the California Department of Housing and Community Development and ICF, our TA provider for multiple grants that we have. They shared with us that there is a tribal ESG CV recipient who wishes to remain anonymous at this time, who is in a Northern California rural community and is having great difficulty gaining access to the local HMIS. It's primarily an issue regarding the contract that the COC lead entity is requiring all HMIS end user agencies to sign. It's identical to the contract that the HMIS lead signs with the vendor. And so they're expecting HMIS end users to be able to provide the level of work that an HMIS vendor would do, which is virtually impossible. And so the tribal entity won't sign the agreement because they can't honor it. And so they're struggling with how do we record our information in an HMIS? And so they came to us knowing that with the understanding that we have several tribal communities. We've done really great work with our HMIS in regards to coordination with our tribal partners locally. And they thought that we would be a good fit for this need if our COC is willing to host this one organization. This was discussed last meeting, and there wasn't a lot of support for it because there was concerns regarding how it would affect us later down the road, how it would affect our reports, and if we are able to actually do it correctly because of our low amount of HMIS capacity. So I'm bringing this to the COC. We don't have to formally vote on this. This is just direction to the HMIS lead. Are we open to this or not?
Let me ask one question, Veronica, before we
Yes.
open it up. Isn't this against HUD's own rules?
Yes, yes. HUD has said we would not normally allow this, but because of the extreme circumstances, they're willing to waive their own regulations.
Okay, so why, let me ask this other question. If this is an extreme circumstance, why don't they make this other COC make a reasonable contract that's not outrageous?
Because they don't have that kind of authority. HUD
Oh, I'm
can't-
sure they have that authority someplace in their book.
People
People that have the money have the authority.
I got the checkbook.
I don't understand
Right.
the legal side of between that COC and HUD. I can't pretend to know anything about it. I just know that it's a long, difficult road that is really impacting this tribe's ability to record and report their work.
I'm
So
sure.
Veronica, so Dan, I think I'm going to ask probably what you're going to ask in that. So this isn't like we would clone our HMIS and they would have a unique portal. Their data would come in and be with ours. So there would be wouldn't it? I mean, is that true?
Well, we would create it at a high level saying that here's CA 509, which is Mendocino County, and then here's this other CA 5 or 609 or whatever it happens to be. And so they would be segregated. The data would be separated. However, I remember whenever we were programming these back early on, Brian said that it's good that we only have one COC, because if we ever expanded to have a second COC, we would have to have an overall overhaul on how we have our system structured. And so we could be opening a can of worms that I haven't a clue what it would impact or even how to address it. I would literally have to hire WellSky to do this work.
My opinion is probably all over my face already, but this sounds like thanks for thinking of us, and like that's nice, and that sounds like a mess that we should stay out of for all sorts of reasons. But like, let's just go with HMIS lead capacity, who would have to hold the administrative weight of this, of like putting together the HMIS, the programs on HMIS that they would be enrolling people into and communicate. Anyway, I'm gonna say pass, please.
You know, I misspoke just now. ICF said that they would do 100% of the work necessary to set up the system. We would just have to provide them access. The only problem is if it leaches over into we need to do more for our overall system, I don't know what kind of support they'd be able to provide, because they just don't know our system inside and out.
Okay, well, even hearing that, I'm still going with pass for political reasons.
So
I'm gonna say, Judy.
Well, you know, I don't know that much about the HMIS system, but I thought one of the reasons that it is useful is because all the agencies who participate in it can then look at clients and crossovers, et cetera.
Shared history, yes.
Shared history. So another county, our county, what value, except for a database?
It wouldn't even show up in our information. It would
No,
be
I know that what I'm saying, but
Exactly.
what even value for them? Let them just have a database, because they're not going to get any value from our HMIS either. We're not going to get value from knowing their history. They're not going to get value from knowing what happens to county clients in our county.
Right. That wouldn't even, it wouldn't benefit us in any way.
Any other thoughts besides Sage's no?
I'm a no also.
I'm a no also, and
Me too.
Veronica, I'm very sure that our CHTC is gonna run smack dab into this other contract. And I'll let you know what the outcome that takes.
Okay, because you might have to sign that contract too.
No,
You work with that COC.
I know we do, and I'm not signing the contract, so we will see how it runs headlong into HCD's No Place Like Home program and HUD, and I'm sure it's going to be an entertaining conversation with our legal team. So,
Okay.
Blythe,
Well, I will let them know. Sorry, go ahead.
anybody else have any other thoughts?
I think we need to remember how much time, energy, investment we put in this to get it going, and how, it's a big commitment, and I feel bad for them, but I don't feel bad enough to jeopardize what we got going. So, I think we need to do what we can do for what we wrap our COC arms around as best as we can. And that's what we've committed to do. And I don't feel guilty saying we can't help, because when you think of what it really took for, and I'm sure there are people with good intentions saying, we'll do all the work. We said that too before we knew what the work was.
Mhm.
So, this just seems odd.
Mhm.
I agree. And I also think that Dan's right. I mean, if HUD has the power, I mean, I feel like there's another way around it besides us, assisting with that. So.
All right, we'll move on to the ad hoc committee if there's nothing else then.
So did I understand that the directive is no?
Yep.
Okay. And there's no disagreement with that from anyone present? Just to give them an opportunity? Okay.
I feel sorry for the tribe too.
I do too. I mean, I really do. But there's got to be other political influencers that could come to their aid. I mean, that are more influential than we are.
All right, we'll move on to ad hoc committee, Veronica. For the point in time count.
Yes.
I see we got a new user, Zoom user.
I think that might be Joanna. Joanna, is that you? You're muted. Oh,
Okay, I had to get in on my phone because my computer died. Sorry.
okay.
No
We
problem.
just wanted to make sure we knew who you were. I'm going to rename
It's
you.
me.
Joanna.
So that's the iPhone that we see?
Yes.
Okay. They're her name. She's named now.
Perfect.
Okay. We are working with SimTech on deduplicating our data and to, I remember, and to ensure that our data is cleaned up as possible before we do any of our exports. I wanted to share that today, I'm going to mute you, Joanna. Today I learned about an article that appeared in the Anderson Valley Advertiser. I'm looking for the exact email now. It was by Mark Scaramella, and it's regarding our point in time count and the contract. It's not very favorable. I won't take the time to read it, but that's something that you might want to check out. Again, that's the Anderson Valley Advertiser. And also I've been answering questions and did an interview with Frank with Mendocino Voice. I can't recall his last name, but I know he's doing an article as well. So I just wanted to give the board a heads up that that's been happening. And that's pretty much all I have, except that we have until April 28th. That's whenever everything is due to HUD. So we're really, finishing up our data review, working with SimTech on making sure we have everything right.
So Veronica, not that I've read the article, but I've never known the Anderson Valley Advertiser to make any positive comment about anything happening in the county of Mendocino.
You're saying we're in good company, Judy?
Yes.
I find anybody doing anything is.
Veronica, that's Frank Hartzell, by the way.
Oh, thank you. Thank you, Dave. Paul. I read your last name and said David. Okay. That's
just a comment to everybody as members. Every once in a while, I will weigh in just because there's a misunderstanding that, what we're doing usually is determined by COC rules, but there are local people that assume we get together and decide how we do some of these things. So often, although I don't know that it matters, I try to explain or respond to some of these things, just that that we're required to follow the protocols established for a point in time or whatever. So they begin to expand their understanding. I don't know if it works, but anytime we get that opportunity, we should probably try.
I do think it's important to read the last two sentences of what he wrote, because it does kind of summarize what Jackie's getting at. He writes, but there's nothing in the app about duplication prevention or incentives that might artificially increase counts or any of the other point in time count flaws identified by the Marbut report, which said the Mendo's point in time counts significantly exaggerate the number of homeless persons in Mendocino County. There's also no mention of whether the app helps in determining if the county is a local or a traveler. And I would point out that we do have methods for deduplication because of we get descriptions of what the person looks like in the observational survey. And that was one point that was in the Marbut report about being able to deduplicate based upon information. So we did do that one. We also we were no longer just counting an RV. We're actually going up and knocking on it, or there has to be some kind of indication that there's actually somebody there. It's not just if it's an RV in somebody's driveway that looks like there might be somebody there, we count it. We do more than that. So there's multiple points in which we have incorporated Dr. Marbut's recommendations. And we do ask how long they've been in Mendocino County. So we don't ask every single person we see if they're a traveler or if they're, what in his language, but we do ask in our surveys that we do our best to be representative of the population, that we can then apply that percentage to the full population of who is local and who is not been local for very long.
Sage. Oh, keep going, Veronica.
No, that's all I have.
Sage.
I would add about the local versus non-local people as well, that the point in time count, the purpose of it is that one night, who's on the street, who's in the shelter, and its purpose isn't to look at whether they're local here or not. But that isn't to say that we don't have mechanisms to determine, to get a better idea of who we're serving and of who we're seeing in Mendocino County in terms of locality, whether they're local to Mendocino County. And the state has actually done a lot of work around using HMIS data, which in a lot of ways is more reliable than one night worth of count, right? So the pit count is one night. HMIS data is long, people who we've done screenings on, gotten information on, ensured that we're not duplicating all of that. And the state has been able to look at movement between counties and between COCs across the state. And because of that concern that people are traveling, and that there is that concern that the people coming to Mendocino County, that there are people coming here to access homeless services. And so I'm probably speaking to people who already know that that data is being collected and reported on by the state. But if you didn't know, I find it's a helpful thing, because the data that California has collected shows people are not moving between COCs. The majority of people are staying in one COC to access services. And maybe there's a very small number who are accessing two COCs, and usually they're neighboring COCs to each other. So like Mendocino and Lake or Mendocino and Sonoma, but they're not. What the data across the state is showing is people are not traveling to access homeless services.
Thank you, Sage. Anything else on point in time? We've still got a lot of agenda items. And we're going to move on to board protocols and governance. Do you want to explain the first possible action, and then we can discuss it and get public comment?
Yeah. So the first two action items here, well, these three are, the next three are really related. The first one is for our HMIS policies and procedures. There are certain places in it where it references all of the agencies or entities that we share our HMIS data with. And that includes, HUD or HCD. We recently had to add California Interagency Council on Homelessness for their homeless data integration system. And now that we have a data sharing agreement with Partnership Health Plan of California, we need to disclose in our policies and procedures, as well as our privacy policy, that we're sharing this data. And so I've revised the HMIS policies and procedures to reflect that. The agenda has a summary of the 3 changes that have been made, and with the specific page referencing them. And the full policy and procedure document is included with your agenda, and it includes the changes. Anything removed is in red line, anything added is in blue. That's my summary.
Sage?
Can I move to approve?
Yeah, you can. Is there a second? Jackie?
I'll second.
Is there any discussion or comment on this? Any public input? Not seeing any public comment or input from the board. Roll call, Veronica.
Please say yes, no, or abstain to approving the revisions presented to the HMIS policies and procedures. Teresa DeSimone.
Yes.
Jacqueline Williams.
Yes.
Joanna Olson. I'm going to unmute you.
Yes.
You got it.
It's just not as easy on my phone, ladies. I'm sorry, and ladies and gentlemen.
You're fine. Thanks. Paul Davis.
Yes.
Noemi Guerrero.
Abstain.
Karen Lovato.
Yes.
Blythe Post.
Yes.
Amanda Archer.
Yes.
Judy Albert.
Yes.
Sage Wolf.
Yes.
Dan McIntyre.
Yes.
And Sandra Stolfi.
Yes.
Motion passed.
Then we'll move on to the next possible action for the data sharing.
So the HMIS partner data sharing agreement is something that was identified in our HMIS capacity building grant. And it's something that we had at the very, very beginning of our HMIS, but when there was that initial staff turnover, the document was lost and it kind of fell off. And so with the help of RTA providers, we have developed an HMIS data, a partner data sharing agreement. And so we would ask all of our existing HMIS users or agencies that participate to sign the new agreement. It's nothing that they don't already do, but it's more of, it outlines like what to do in certain circumstances. So if there's like a data breach or something happens, what to do in those situations. And it informs the agency, what their liability or their required responsibilities are. And so, because at this time, all we have is an end user agreement, nothing saying that the agency agrees to participation. And so this document really would establish that.
Any questions for Veronica?
And I move to approve, please.
Yes, Sage.
I second.
Thanks, Blythe. Is there any public comment? I don't see any public comment. Is there any further discussion from the board? Not seeing any hands. Roll call, please.
Okay, please say yes, no, or abstain to the motion to approve the draft 2023 MCHSCoC HMIS Partner Data Sharing Agreement. Teresa DeSimone.
Yes.
Jacqueline Williams.
Yes.
Joanna Olson.
Yes.
Paul Davis.
Yes.
Noemi Guerrero.
Yes.
Karen Lovato.
Abstain?
Blythe Post.
Yes.
Amanda Archer. Amanda, excellent. Judy Albert.
Yes.
Sage Wolf.
Yes.
Dan McIntyre.
Yes.
And Sandra Stolfi.
Yes.
Motion passed. I just wanted to announce that we just had another person, COC member join us. Mariah McGill from Northern Circle Indian Housing Authority has just joined us. Welcome, Mariah. Okay, Dan.
Good afternoon.
We're going to go on to the next, the review of the executed data sharing agreement with Partnership Health. It has Megan's name on here, but I don't see Megan. So Veronica, you get stuck with this one.
Okay.
Or we can come back to it.
Can we come back to it? There's certain details and questions the board may have that I don't have answers to.
Okay, we'll come back to it. We'll come back to it when I see Megan pop back in.
Okay, thank you.
We'll move down to funding. So we had a funding meeting. What is this, Veronica? Now like 3 weeks ago, probably? Something like that, about 3 weeks ago. To go over these HAP and some of the funding rounds that need to get approved for existing contracts.
It was longer than that because we had it ready at our last meeting. So it was early February.
Okay. My days blend together. So you want to go over HAP and the recommendation for round threes?
Yes. So there's 2 recommendations under HAP, but before I do that, I wanted to share that I this week finalized like the last little amendment that was needed for our HAP 4 round 4 application was submitted. And so the state has everything that they need to move forward. The next step will be us receiving the funds. And so we haven't yet identified how to budget and utilize the HAP 3 funding yet. And because items have been coming up, I've been coming to the board and saying, hey, is this okay if we fund it? If I get approval here, then I bring it back to Becky and get the county's authority and approval to use it as funds. And so I'm coming to you guys for the first one. And I'm requesting approval to use HAP3 initial disbursement funds. So round 3 is different than any of the other rounds in that it's over $2 million, but 500,000 and plus some change has to be used for system support only. So HMIS work, things to support the point in time count, things to support, like maybe it's a consultant that we hire and they support us in helping us learn how to make improvements, like what we did with Maury Rogan. So I'm coming to the board today asking for permission to use HAP3 initial disbursement funds to pay for our subscription for the Counting Us mobile application. This is a retroactive request. We just had to kind of move forward and get it done. And because we didn't have a December meeting, it caught up to me. So I'm coming to the board and asking for permission to use HAP3 funding for our pit count subscription.
Any questions or discussion for Veronica?
How
Yes,
much
you
is
can, Paige.
It's $22,350.
Sounds like a good use. I move to approve.
I'll second.
Any questions, Judy?
What does it do for $22,000?
It does a lot.
Okay, all right. I'll believe you.
The first thing is it comes with a volunteer registration portal. So instead of every volunteer who wants to participate, instead of them sending an email to Veronica and then Veronica having to process every single email and create her own mailing list, instead, they provide a web page where anyone interested in volunteering can go in, register, and it adds it to our system. I can then export a file from that system and have all of the emails and all the contact information all at once. So it took out, it's like a 10th of the time that it used to be, probably 100th of the time if I really want to think about it. It also, instead of using paper surveys that we then have to hand type into our computer, everything is electronic. It all comes from on a mobile application. It can be a tablet, it can be a cell phone, it can be anything that, and it doesn't even have to have active service because the app is able to store information and then upload it into the database once you're connected to any Wi-Fi or data or whatever. It also helps us with deduplication because it does a, what am I trying to say? It's a
Geomarker?
Yes, geospatial marker. Thank you. So it tags where that survey was physically done. So let's say that there's 2 people in Willits and this is actually what happened. There was 2 groups counting downtown Willits. One was north of Safeway and one was south. Well, there's an encampment behind Safeway. What happens if both groups actually do surveys over there? We're going to know because there's going to be a dot here and a dot here. And this one's going to be by Ben and this one's going to be by Jen. And I know that because they're in the same spot, but by 2 different people, it's a duplicated record. And so it helps us to be able to deduplicate it in addition to what are your initials, what's your age range, those kind of things that we would use before to deduplicate. Well, now we have those, and we have where they physically did the survey. That geospatial record also helps us to know what the distribution of people are experiencing homelessness, who's on the coast, who's in Ukiah, who's in North County. We didn't have that knowledge before. We had, somebody did a survey on the coast, so maybe they're from the coast, but maybe they just happened to be visiting for the day and they did the survey while they were there. Those kind of things we couldn't tease out, but now we can. I could go into telling you other features, but I think that might be enough.
Any other questions? Karen?
I'm assuming this is the 22,000 was an annual subscription. Is there any worry about when the HAP funds are no longer available, how to sustain it?
So this is actually the second year that we have used this subscription. The first year we were able to use ESG CV funds. And so we're using HAP funds this year. And I know we'll be able to do that as long as we have funds available through 2025. And my hope is that the state creates some form of permanent form of funding that they're doing HAP with. And so we're reorganizing how our homeless services are really provided through social services. Like Megan now, she's taken on that, bringing families home through child welfare, through the front door for families approach. And so that's an integration of a child welfare service that we never had involved in our services before. And so I'm really hopeful that if HAP isn't available, an alternative source of funding will be. And if we absolutely push comes to shove, there is an alternative subscription through I can't remember the name of their company now, but their subscription is $4,000 a year. We opted against that one because it doesn't do geospatial. It doesn't have the volunteer registration portal. It's really just recording your surveys and nothing else. And so we opted against that one. But if ever finances are a concern, we could use our COC planning grant and write in like $4,000 for that one.
Thank you, Karen. Any public comment on this before we roll call? Any other discussion from the board? Not seeing any. Roll call, please, Veronica.
Okay, when I call your name, please say yes, no, or abstain. Teresa DeSimone.
Yes.
Jacqueline Williams.
Yes.
Joanna Olson.
Yes.
Paul Davis.
Yes.
Noemi Guerrero.
Abstain.
Karen Lovato.
Yes.
Blythe Post.
Yes.
Amanda Archer.
Yes.
Judy Albert.
Yes.
Sage Wolf.
Yes, and I'm off. I'm running. Bye.
All right.
Yes,
Thank you. Dan McIntyre.
yes.
And Sandra Stolfi.
Yes.
Motion passed.
Okay. We're going to continue the funding, and then we'll wrap back up to the previous one.
So the COC approved creation of emergency shelter project funds with 4 organizations that requested HAP funding to support their existing projects. Those 4 contracts are presented to you today. In your packet, you'll find the COC standard, not the COC, the county contracting standardized language that begins on page, I'm almost there, page 84 of your agenda packet. And so you can see the general terms that are there. And then you'll find Exhibit A, which is a definition of services. and Exhibit B, which is the budget for each of these 4 organizations.
Veronica,
Yes.
this is Joanna.
Hi.
So I just wanted to point out that on page 107 for the McCavan contractor, under contractor, it doesn't mention our name.
No, because it'll mention it in the earlier parts of the contract, and that's how the county writes their contracts.
Okay, but it did mention it on the other contract, so I just wanted to point that out. That
Okay.
in
We
this
always
handout.
I always try to get them to like list the name and they always take it out. So maybe the other one, you were lucky enough to get your name in there. I think it's
Okay.
like a strange, we've even tried to put it down in like the bottom, just like the name of
I
the
think,
contractor, and
I
they take
think
it
I
out.
know, it was an error because remember, I got back to you and I said, a lot of this language in here is for congregate shelters, so you guys had to revise it. And I have a feeling that's what happened.
Yeah. I wish the names would show up more. It's like confusing to have them.
Right.
I just thought maybe you guys might want to shove it in there, so I was letting you know, okay?
We'd like to, they won't let us.
All right.
So
I'm
the
good.
only time, so I see what happened, like on page 101, the first page of Ford Street Projects Exhibit A.
Uh-huh.
It says provide congregate or non-congregate shelters. Oh, wait, provide access to Ford Street Project Unity Village Emergency Shelter. It names the project, not the contractor.
Yeah,
And so because the contractor is defined on page 1 and the contract language, because it says
Okay.
county and then defines the really long name. So
Right.
it's just the way that the legal people do it.
all right. If you guys are okay with it, I'm okay with it, okay?
Okay, but to finish up my introduction, there are 4 Exhibit A and Exhibits B for this board's review. One with Ford Street Project, one with, and that one is for both congregate and non-congregate shelter. We have one with McCavan, which is only congregate shelter. And then we have contracts with Mendocino Coast Hospitality Center and Redwood Community Services, both of which are congregate shelter. And these are to extend funding to continue operating their projects. Done, and that's all.
I will need a motion to approve. Do you want to do it one at a time, Veronica, or do you want to do?
We do need to do it one at a time, yeah.
Right. We need a motion to approve Ford Street's project contract.
I motion to approve Ford Street project as submitted to the board.
Thanks, Blythe. The second.
I'll second that.
Thank you, Teresa. Is there any questions or comments from the board? Public input? Not seeing any public input or comments from the board. Veronica, roll call, please.
Please say yes, no, or abstain when I call your name. And just as a reminder to our contractors, if this is your contract, please abstain. Teresa DeSimone,
Yes.
Jacqueline Williams,
Abstain.
Joanna Olson,
Yes.
Paul Davis,
Yes.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post,
Yes.
Amanda Archer,
Yes.
Judy Albert,
Yes.
Sam Neto,
Yes.
Dan McIntyre,
Yes.
and Sandra Stolfi.
Yes.
Motion passed.
Okay, thank you. Now I need I have a motion for McCavan's contract.
I move that we approve McGavin's contract.
Thank you, Jackie. Is there a second?
I'll second.
Thank you, Blythe. Any comments, public comment? Any discussion from the board? Not seeing any public comment or discussion from the board. Roll call, Veronica?
Joanna, I muted you because we were getting some feedback, just so you know. When I call your name, please say yes, no, or abstain. Teresa DeSimone,
Yes.
Jacqueline Williams,
Yes.
Joanna Olson,
Abstain.
Paul Davis,
Yes.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post,
Yes.
Amanda Archer,
Yes.
Judy Albert,
Yes. Yes.
Sam, thank you, Sam Neto,
Yes.
Dan McIntyre,
Yes.
Sandra Stolfi.
Yes.
Motion approved.
Thank you. We're gonna go down to Mendocino Coast Hospitality Center. I need a motion to approve that.
I'll move to approve that.
Thank you, Teresa.
I second that.
Thank you, Sandra. Is there any public comment? Not seeing any public comment. Is there any discussion or questions from the board on this contract? Not seeing any public comment or discussion from the board. Roll call, please.
Again, please say yes, no, or abstain. Teresa DeSimone,
Yes.
Jacqueline Williams,
Yes.
Joanna Olson,
Yes.
Paul Davis,
Abstain.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post,
Yes.
Amanda Archer,
Yes.
Judy Albert,
Yes.
Sam Neto,
Yes.
Dan McIntyre,
Yes.
Sandra Stolfi.
Yes.
Motion approved.
Thank you, Veronica. Okay, we're down to Redwood Community Services contract for congregate shelter. I need a motion to approve that.
I move to approve it.
Thank you, Judy.
I second to approve it.
Thank you, Joanna. Is there any public comment on the Redwood Community Services contract? Any questions or discussion from the board? Not seeing or hearing any public comment or discussion from the board. Roll call, please.
Teresa DeSimone,
Yes.
Jacqueline Williams,
Yes.
Joanna Olson,
Yes.
Paul Davis,
Yes.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post,
Yes.
Amanda Archer,
Yes.
Judy Albert,
Yes.
Sam Neto,
Abstain.
Dan McIntyre,
Yes.
Sandra Stolfi.
Yes.
Motion approved.
Thank you.
Dan, just a brief update for the contractors, Ford Street projects and the Coast Hospitality Centers contracts will be before the Board of Supervisors tomorrow. The other two, McCavan and Redwood Community Services, will be before the Board of Supervisors on April 11th.
Okay. So we're going to move down to cash funding. Veronica, do you want to go over the draft languages with the contract for Nutmeg Consulting? Sounds like we're going to make some cookies here.
We can do that, but I wanted to check in. Do we want to go back to the board protocols and governance or finish funding first?
We'll finish funding and then we'll go back
Okay.
up there.
Fair enough. Okay, so the board had approved release of an RFP, request for proposals for a coordinated entry list manager. And we received response from Nutmeg Consulting Incorporated. We have finalized a draft contract with them. And it is presented to the board. It is using cash funding that was required to be set aside for use for HMIS or coordinated entry system improvements. And so this utilizes both rounds of funding through Cash 1 and 2, and fully supports this project. And I can say that our coordinated entry committee highly recommends the approval of this contract. Any questions about what it's to do? Or is that pretty straightforward?
Anybody want to make a motion to approve this draft contract language?
I will, Dan.
Thank you,
I
Jackie.
was
Is there a
just,
second?
I was just confused. It says review and approve the draft language, but we're really approving the contract, aren't we?
Yeah.
Okay,
Yeah, it's the draft language, contract language.
okay. That's my
Yeah.
motion.
Thank you,
I
Jackie. Is
second.
there a second? Blythe? Okay. Thank you, Blythe. Any public comment?
I'm not public. Oh, sorry, finish with the public. There's no public comment, is there?
No public comment. Is there any questions or discussion from the board? Or Megan?
I just wanted to remind the board that this was a goal in our strategic plan from like 3 or 4 years ago to have a coordinated entry list manager. And I'm just super excited to finally get there. And I do want to, they're not here, but Sage and some other members of the board have really been carrying this ball for a long time without, just from the goodness of their heart. So I'm super excited to have an outside consultant, sort of a neutral party, keeping us all on task and like keeping that list moving and focused, because it's a lot to figure out collaboratively. And this was a goal from ours from 3 years ago. So we should be really happy we're getting it done.
Any other comments or discussion? Not hearing any other comments or discussion or no public comment. Roll call, Veronica.
Please say yes, no, or abstain when I call your name. Teresa De Simone,
Yes.
Jacqueline Williams,
Yes.
Joanna Olson, Joanna,
Yes, my screen's not behaving. Thank you.
you're welcome. Thank you. Paul Davis,
Yes.
Noemi Guerrero,
Yes.
Karen Lovato,
Yes.
Blythe Post,
Yes.
Amanda Archer,
Yes.
Judy Albert,
Yes.
Sam Neto,
Yes.
Dan McIntyre,
Yes.
Sandra Stolfi.
Yes.
Motion unanimously approved.
Thank you. We're gonna move back up to board and governance now, since Megan's here. If you want to go over the data sharing agreement with Partnership Health of California, Megan.
Sure. Did you, I'm sorry, I was gone. Did you talk about it at all
No, we skipped it.
entirely? Okay.
Yep.
So it looks like there's all 3 of these items are related to this, aren't they?
And we approved the first 2.
Oh, you've heard the first 2. Okay.
And they understand why.
Okay. So I'm speaking specifically to the data sharing agreement with Partnership Health Plan. Okay. So
Yep,
I'm
item
afraid,
3.
yeah, I'm a little bit afraid I'm going to duplicate some of the things that Veronica said, but I'll do it quickly if I do. Partnership is being given this fairly difficult and kind of ridiculous task of verifying the homelessness status of all of their Medi-Cal recipients. And they have to do this by having specific agreements with every COC, rather than just working with their partners at the state to figure it out, who Veronica already reports this information to. But we understood there's some sort of reason that's happening in the way that it's happening. So Partnership has, asked us to do this process with them. It's both straightforward and kind of dumb. So we have to produce a list for them every 3 months that indicates the homelessness status of everybody in our HMIS system, that they are then going to match with their Medi-Cal system. I know, I can see some of your expressions are like, what? So I agree. But they have to do this. The state is making them do this. They're giving them incentive dollars to do this. They are passing some of those incentive dollars back down to the counties to do this, to support homelessness services. So it's just, we're all doing this kind of exercise together. And the data sharing agreement you have before is their kind of boilerplate data share agreement that they're trying to put in place with every COC. So, Veronica and I were like, this seems weird. Should we try to like find out if this is like kosher? It's like, seems to be the standard practice they're doing with all of their COCs. And they're not, with a great deal of surprise, I think they've not been successful with one of them yet in terms of getting a clean list that makes sense that this process is working. So it's going to be an exercise in learning
Utility.
together. I don't know what to say about it. I mean, I guess we'll see.
I was, as soon as you said quarterly, I was okay. I was trying to imagine what we're going to run a report annually and think, like people's status changes.
Exactly. I mean,
This
annually,
is a moving population.
absolutely. And, and I've said repeatedly, if somebody gets housed, they don't like necessarily call us up and tell us, right? So they usually don't call us up and tell us, right? Unless we like specifically help them get housed, but a lot of people, or they move out of the county, right? Or they never, so it's going to be imperfect at best. What the big, huge picture thing is that California is investing a lot of Medi-Cal money to support people that are experiencing homelessness. And they would like to show over time that investment is leading to a resolution around homelessness.
Yeah.
I don't know what to say. I mean, it's marrying a healthcare system and a homelessness system in recognition that homelessness status impacts health. It's the right kind of recognition, but it's two very separate cultures. Oh, look, and here's Lynn to join us. So
Run, Lynn, run.
Perfect timing.
So Lynn, we're approving the data sharing agreement so that we can give you the list and we'll all figure it out together how useful it's going to be.
Yeah, no, I think you did a great job, Megan. I just would add that, part of the purpose too is to make sure the services are integrated with CalAIM. And, often, our staff finds out they're working with someone who they're trying to discharge from a hospital and nobody knows, who they've been talking to. Are they in coordinated entry? Do they have a case manager? So I think it's a, baby step of trying to get systems to work together, and it is very clunky, et cetera. And yes, and someone said, Medi-Cal status can change every month, but, we hope that it doesn't for this very vulnerable population. We definitely want to keep them covered and also try and, make those transitions of care better for those who are homeless, because they do, there are quite a few hospitalizations and sometimes we just don't know what's going on with that individual. I think this will help. So I appreciate, Mendocino County stepping up and helping figure this all out.
And just to add to that, I don't know if Veronica shared this either, but when we started working with partnerships data people and I was kind of like understanding what the request was and how it would fit with our HMIS system, those of you in the COC know that we have limited staffing right now in Veronica's department. And I was like, you know what, we need to figure out, since we are getting some financial incentive funding from partnership, we're actually going to take some of that money in turn. And the vendor for our HMIS system is going to help build the report that we provide to partnership. So rather than trying to figure out internally, and they provide for a lot of COCs, so this is going to be I think a financial boon for them as well, because what they build for our county will be relevant for other counties and will actually possibly create some consistency across counties that are using the same systems. So Veronica is working that contract through the process so that we can use Well Skies services to help us develop this report. Is that accurate, Veronica?
Yes, it is. Yeah. I'm gonna stick quiet.
Yeah. So we'll see how it goes.
So Dan, it looks like we just need to make a motion
That is
on this one.
correct.
So I move that we approve the executed data sharing agreement with Partnership Health Plan of California.
Thank you, Jackie. Is there a second?
I can second that.
Thank you, Teresa. Is there any public comment on this contract?
I feel like I need to make public comment as a member of the public and not as a county employee. I kind of am frustrated with this process because it's utilizing public funds to duplicate something the HMIS lead is already doing for the state. In the HIP frequently asked questions, someone asked, why is Department of Healthcare Services not linking data at the state level to the data at our HMIS systems that we already share with Cal ICH on a quarterly basis? The response is, based on discussions with partners, Department of Healthcare Services determined the program should be designed to account for the local variability among different providers and the landscape of homelessness from one geographic region to the next. As a result, DHCS is encouraging data sharing with managed care providers at the local level rather than linking through the state level, which would result in less timely and less actionable data sharing. If the COC is utilizing its HMIS vendor to share this information, I'm feeling like that local level of data coordinating, by having the HMIS vendor do it, we're losing that. And so the whole heart of the purpose of receiving this data to get us to connect and work together better is not going to happen because of lack of capacity. And that is my opinion and comment as a member of the public.
Thank you, Veronica. Any other public comment? Hearing no other public comment, is there any discussions or questions from the board? Not seeing any other comment or discussion from the board. Roll call, Veronica.
Please say yes, no, or abstain when I call your name. Teresa DeSimone.
Yes.
Jacqueline Williams.
Yes.
Joanna Olson.
Yes.
Paul Davis.
Yes.
Noemi Guerrero.
Yes.
Karen Lovato.
Yes.
Blythe Post.
Yes.
Amanda Archer.
Yes.
Judy Albert.
Judy
I'm
is
abstained
okay.
because she's away from her desk. Sam Neto.
Approve, yes.
Dan McIntyre.
Yes.
Sandra Stolfi.
Yes.
Motion approved.
Thank you, Veronica. All right, we're gonna go back down to funding. We're all done with funding, so we're gonna go on to move on to projects. Does anybody have any projects? I don't see any listed here, so.
I just wanted to mention that I sent an email out shortly before this meeting announcing the California Dream for All. It's a shared appreciation loan program. And it's a new program the state has created to help new home buyers who don't normally have the ability to pay for the full down payment or closing costs. And I believe it's part of the actual mortgage itself. And so it's a partnership between like a philanthropist or someone in the state that would like to give funding to the program. And it's basically like the home buyer and this other third party go in on the mortgage together. And so it's a new way of thinking about it. It's not using state funding, it's using private funding, but it's helping to coordinate parties that don't normally ever connect. And so there's a link in that website, which is calhfa.ca.gov/dream.
Thank you, Veronica. Not seeing any other projects, we'll move down to announcements. Mariah?
Yeah, hey, good afternoon, everyone. I'm Mariah McGill, and I'm with Northern Circle Indian Housing Authority. I just kind of want to give an update. I haven't been at the last couple meetings, but an update on some of the programs and projects that are being carried out in Mendocino County, Indian Country. This coming April 10th, we'll be hosting a tribal HAP. So the Homeless Housing Assistance and Prevention Program, a listening session. 20 million available for federally recognized tribes to carry out the HAP program. So we're hosting a listening session for all federally recognized tribes throughout California at Consolidated Tribal Health from 9 a.m. to noon. We're anticipating the NOFA release of Home Key for the tribal set aside. And this last round, there's Northern Circle will be building a fourplex for chronically homeless tribal members, prioritizing the Hopland Band of Pomo Indians. And then Giddyville Indian Rancheria will be doing 15 chronically homeless units, prioritizing the Giddyville Indian Rancheria. And so those are things coming up. There were many awards in the tribal HAP program this last year. So there's a lot more culturally significant and culturally mindful and sound programs coming up. So I would hope that the COC potentially would be interested in some sort of special meeting for the community to announce the rollouts of those programs and finding ways how Mendocino County COC can create partnerships with tribal communities, particularly the awardees of Home Key, Tribal HAP, ESGCV, and so on and so forth. So I think there's a lot of ways that we can ensure that we are creating partnerships that are culturally significant and also being mindful of historical trauma and years and years and years of state and federal funded genocide. So I'm hopeful that we can work together and find ways to really serve a population that's overlooked and underserved. So that's kind of what's going on in Indian Country here in Mendocino County. So stay tuned. Thank you so much.
Can I
Thanks,
ask a
Brian.
question, Dan?
Yeah.
Hi, Mariah. I just wanted to is the fourplex in Hopland new construction, and is it in Hopland?
Yeah, it'll be on tribal trust land, and it's new construction. It's utilizing Home Investment Partnership, which was awarded on February 19th, 2019. So it's one of those things where HCD takes a long time for standard agreements for non-tribal projects. This will be their first ever tribal project, and it's taken since February 19th, 2019. We still don't have a standard agreement and had to come up with gap financing because there was no way you could build a fourplex in 2023 with 920,000. So it's the Home Key project is a mix of home and Home Key to build the fourplex.
And then is the 15 units in Giddyville also new construction? Is it going to be on the Giddyville area? Okay.
Correct.
So you're looking at a timeline of at least a year then probably before they're ready?
We're optimistic that the Giddyville project can be kicked off relatively quick because it's only Home Key and Tribal HAP as well. So those funds are a little bit faster to roll out. The Hopland Fourplex project might take a little bit longer because of the standard agreement and being able to tie in Assembly Bill 1010 waivers, and there is no template for tribal projects. So we're recreating the wheel.
Awesome. Well, thank you for that. And last question.
And yes.
Are they all like one room, or will you be able to welcome any families, do you know, to these sites?
Yeah, so the Hopland project is the unit itself is 4,000 square feet for the fourplex, and we have two 2-bedroom units and 2 3-bedroom units.
Oh, awesome.
And
Okay.
that's to be serving chronically homeless at 50% AMI.
And the Geedyville one are single.
Yes,
They're single
they'll
room-
be
single
studio apartments.
Studios. Okay. Great. Thank you.
Yeah, and
excited.
Northern
I can't
Circle will
wait.
be doing property management for both of the projects.
Fantastic.
Yeah, thank you so much.
Any other announcements?
Behavioral Health and Recovery Services is going to be recognizing April is Alcohol Awareness Month. And so in addition to a proclamation in April, we will be present at a number of community events. At this point, we are planning to be at the Veterans Art exhibits that are happening at the Alex Thomas Plaza this weekend. Willett's Farmers Market. We were invited to Spirit Run in Redwood Valley Rancheria. And the Earth Day celebration at Cato, and we also plan to be at the Farmers Market in Fort Bragg. So just a reminder of Sober and Alcohol Awareness Month. And if you are out and about in the community and you see behavioral health, swing by and say hi, grab some resources and materials.
Thanks. Any other announcements before we move on?
Project Sanctuary is also recognizing April as Sexual Assault Awareness Month. And so our prevention people are doing a number of presentations in the local high schools. And we'll also be tabling at the farmers markets and other local places and having a banner across State Street.
Thank you, Judy. Any other announcements?
This is Joanna. I have an announcement that the Event of the Heart is scheduled for June 3rd. And I'll be sending out flyers so people can get information about tickets and how they might donate this important event. Thank you.
Thank you, Joanna.
In the agenda, we have one announcement, just a reminder that we're accepting ongoing nominations for any of our vacant board seats. And so we now have four vacant seats at this time. That's all.
Wait, Veronica, can you remind us which seats are vacant?
Organization addressing needs of seniors. Organization addressing the needs of persons with serious mental illness, just vacated by Manzanita. Organization representing law enforcement, and homeless or formerly homeless individual.
Okay.
Thank you, Veronica. There's no other announcements. We're going to move on to the next meeting is April 17th. But due to this meeting being late, it's right around the corner. So April 17th at 1:30.
It will be a full membership and board meeting. I could arrange to have a guest presentation at our full membership meeting. Are there any requests from the board on who I could invite? Or any volunteers? You know, I'm just going to throw it out there. Teresa, would you be willing to provide an overview of CDC's rental assistance programs? Just a brief overview, because I know that there's been a lot of changes and integration, you know, with the COC. And it might be helpful just to have an overview, but I mean, I understand if you don't have capacity.
Sure. Yeah, we have about 12 different programs. So would you want all of them? All of them?
Well, I think so, yes, because there's confusion in the community, you know, like what's the difference between an HCV voucher and a mainstream voucher? Well, a mainstream voucher is an HCV voucher, but through a specialized program. So I think that there's a lot of confusion in our community, not necessarily with our case managers who are learning, but with our just general information for the community would be helpful.
Yeah, absolutely. I think that over the past couple years, we have become very complicated. Yes. So for sure, I will.
Thank you, Teresa. So we'll have a guest presentation because I know we took care of a lot of business today.
Else we'll see everybody on April 17th.